Let me shift to a second issue in my last minute and a half. The Medicaid primary care parity provision in this year's budget. A study published in the New England Journal of Medicine found that parity in payment over the past 2 years has led to an increase in appointments for Medicaid patients. Unfortunately, the provision that authorized this parity in payment between Medicaid and Medicare expired a month or so ago at the end of 2014. Senator Murray and I introduced the Ensuring Access to Primary Care for Women and Children Act, which would have extended this payment parity for 2 more years. We were not able to enact that so far. Can you comment on the importance of this provision in the President's FY16 budget proposal?
As you were reflecting, we have included it in the President's budget because we think it is important. It comes to one of the issues that we discussed a little bit earlier, which is this question of provision of primary care. As we expand the number of people who are covered, making sure that we translate access to actually care and better health and wellness is what we are aiming to do. We believe that this is a provision based on the analytics that we have seen that can help us move forward on making sure that there is enough care and appropriate care.
Is there a way to use the success of this provision to help guide future conversations around conversations and policy decisions around Medicaid payment reform in the future?
I think all of these pieces and parts, and whether it's the results that we see here in terms of having people become a part of this system of providing that care and knowing that many people on Medicaid have self-report that they have quality care that is accessible, that makes a difference to them, that kind of step in terms of this provision, as well as the kinds of things that Mr. Coates was mentioning in terms of some of the reforms we're doing. I think it's an important program. It's a cost-effective program. We need to continue to look for the ways to make it more effective, both in terms of the quality and the cost.
Thank you, Madam Secretary. Thank you, Mr. Chairman, very much.